some of what we do in functional medicine and everything, and then yeah, kind of go from there for sure.
Yeah, man. I'm
So
excited.
so for you, Doctor Chappa, right?
Yep.
Chopsticks. That's how I'm gonna
Yep.
do
Yep.
it. I'm gonna.
Choppa light chopsticks,
All
baby.
right,
Come
all
on.
right, all right. Okay, for you, Dr. Chappa, where did you start? You said 20 years ago you got your own practice. You're based in Texas. What part of Texas? And yeah, how long you been in practice?
Well, first, I just want to say, man, thanks for having me on the show. I'm excited to just share, some of the wisdoms of 20 years of clinic, essentially. I call it the trench warfare, man. It's where you really learn.
Trench.
Uh, I always say that, medical school taught me how not to kill people, and then being in the trenches taught me how to actually get people well. So I've
Yeah.
started 20 years ago. I'm down southeast Houston, about 30 minutes from the coast of Galveston, and I'm in my third location, and we started in a small space and then kind of grew, and then we grew to a bigger spot. So
Yep.
we're right in the middle of League City, Texas. So about
Yeah.
30 minutes from Houston, 30 minutes from the coast of Galveston. And yeah, it's been good, man. I've had a good career. Got four kids, all born naturally at home.
Hmm.
That's a story in and of itself, and
I love
really
that.
it really did stem from, just being introduced to alternative ways of working with people. And I remember being in student clinic and being offered an opportunity to take this class where we showed up and it was standing room only. And I didn't know really what I was signing up for, but the first 2 hours, John D'Onofrio and Joe Thomas got up, these two docs, and they said, "All right, this is y'all's class. We got 17 hours together. What do y'all want to learn?" And apparently, some of the people had been there before, and they raised their hands and they started saying, "I want to learn about high blood pressure. I want to learn about migraines." And then people started saying, "Well, what about ulcerative colitis and Crohn's disease? And what about eczema and psoriasis? And what about hormone and infertility? And what about my mom's cancer and skin cancer and lung cancers?" And they
Yep.
started just rattling off all this stuff. And I'm sitting there going, "What the heck?" You know what I mean?
Yeah.
And literally, Joe's over there jotting down all this stuff, and and literally an hour into us writing down pretty much every medical diagnosis in the Merck manual, which is the medical Bible of diagnostics. You can read the first two chapters and learn a little bit about some cool nutrition stuff, and then the rest of the book is about how to destroy people's health with medicine. And all of a sudden, he goes, "Great. Now I'm going to teach you for the next 16 hours how to fix everything on that list." And I'm like, "What? There's no way." And no word of a lie, this guy broke down physiology so well, mitochondrial dysfunction so well, showed us to how to understand what inflammation was really doing to the body, that all life starts and stops at the cellular level, and nutrition is the driving force of it all. And so he taught us about third degree burns, and literally I walk out of this class, and Monday morning two people walked up to me, one with eczema that had eczema for 20 years, a female, and one that had psoriasis for 40 years, a dude. And I'm like, did I have like a sign on my head that said I can fix skin disorders? I don't really like, how do these guys even know? And literally, I helped these two people, and I thought maybe we'd get some results in 30 days. I didn't know. I'm not born into this. This is all my first generation healer. And I called Joe and said, "Dude, how do I fix this again?" Because I didn't know what I
Yep.
was doing.
Exactly.
And he says, "Do this, do this, do this, run the autoimmune protocol, do this, do this." And I'm like, "Okay." So I ordered some products for these folks. I didn't even change their diet, dude.
Mhm.
Just deburdening the body,
Yep.
just restoring some nutritional deficiencies. And
Okay.
all of a sudden, in 18 days, Tony, the psoriasis case that was like 40 years psoriatic arthritis and psoriasis of the skin. And I mean, he was a mess, dude.
Yeah.
His psoriasis was so bad that he would get in pools and people would jump out of the pool because they thought he had leprosy.
Wow.
And then the girl was her eczema was so bad she couldn't even bathe her child because her fingers would crack whenever she would put her hands in the water and mess with the different soaps and stuff. And so inside of 30 days, we got her situation about 70% improved. His was 95%. He came to me in tears and was like, dude, you don't even know. You don't even know. You have no idea
Like,
how this has been a burr in my saddle. And so that's where it really started. I really realized that, wow, I was onto something. And then all of a sudden, the doctors on campus started coming up to me asking me, like, hey, what'd you do for Tony? What'd you do for so and so? And I'm like, y'all are the doctors, shouldn't y'all know this stuff? And so I was really puzzled because again, this is all I'm still a student. I don't know anything, right?
mm-hmm.
And then that led to a blood pressure case. Then it led to the what I thought was the hardest case, pseudo tumor cerebri. I'm like, what is that? They didn't talk about that in the class.
Yeah, why not?
And so no word of a lie, I discovered this pseudo tumor, a something that mocks a tumor in the cerebellum,
Yep.
was really kidney congestion. And we fixed the kidneys,
Yep.
and all of a sudden, boom, blood pressure changed, all of her neural symptoms changed, her migraines changed. This lady's life was changed.
Wow.
And so
Bless you, boo. Bless you.
Yep.
at this point, my world is completely shifted. And I am like excited because I realized that these guys didn't just promise us to change healthcare. Like it was transformational, dude. Transformational. So that's essentially where it all started. And then
Wow.
the first 2 years in practice, it was just clinical nutrition, alternative medicine, and it continued to evolve from there. And here we are.
Yeah, that's amazing. That's amazing. And so you were going to you were in med school, you were doing like a bachelor's. What was it specifically you were in there for?
Yeah. So my background is I'm a doctor of chiropractic.
Okay. Yeah,
And
I was
so
gonna say I was like I know they're not you know teaching in the institutions perhaps naturally how to heal eczema without taking a histamine, but that's a different story.
yeah. So
Yeah.
for um that is they did not teach me that at a formal medical
And that's
in
what I try to reiterate to everyone, brother. Like
yeah.
they're so stuck on like this dogma, and then they forget like who funds the institutions. But we're not going to get too far that way. But I want to talk. Okay, now there's a lot of things I have on the sheet here on my monitor, but I want to talk about the fundamental thing that you said that your professor Joe D. I
John D'Onofrio and Joe Thomas.
okay, Joe Thomas and yep,
Out
Joe.
of Ontario, and John was in
Okay.
Pennsylvania. But
Wow.
and John's since passed. But anyway, both of them. Joe went on to be a medical system in Canada is extraordinarily different than it is here.
Oh yeah, I just talked to a guy like a week and a half ago, and they're lockdown. You can't even practice alternative
Yeah,
medicine. You'd get shut down.
yeah. He had to go back to school and get a medical, like become a medical doctor.
Yeah,
So
like
he went
just
to school
become an actual doctor technically, and then
for
start.
practice the way he wanted to.
Yeah, and then practice how you want. Okay, yeah, for sure. Well, it's also not America. Okay, yeah. Anyway, well, I wanted to talk about just the fact of like, okay, so when we're looking at like when people like you and I, and we're looking at a situation, we're looking at like a chronic symptom, a condition or whatever. We're looking at it through an approach and a lens that's holistically looking at the bigger picture. And we look at, that eczema and psoriasis case. Okay, just skin. I can't even wash their child's hands. That's just horrendous. So we're looking at it and we're thinking like, okay, what are the physiological things? Like, what are the physiological triggers that is causing that for that individual? And
Yeah,
that work backwards from the case. Don't work forward, because how I like to teach and how I like to say is that Western conventional medicine doctors do inductive thinking and reasoning, meaning that if I have a psoriasis issue, let me just take a medication to suppress whatever, my immune system rather.
right.
But we want to do deductive reasoning in terms of like, we want to look at, okay, so I have psoriasis. What are all the things that influence my immune system and cause that immunological response to happen on the skin.
So I try to make it as simple as possible for people. So
Yeah.
I always joke around. I don't know what deductive even means, but I can tell you that as a humble pirate, I know that all life starts and stops at the cellular level, and
Yeah.
nutrition is the driver. So therefore, if nutrition is the driver, we got to look upstream from the skin and go, okay, what is skin? Skin is epithelial tissue. Epithelial tissue is the same tissue that is in your digestive tract. So your skin is essentially a mirror image of your GI tract.
Hmm.
And psoriasis or eczema just is where does it show up in the inflammatory in the gut lining for which where does it show up on the skin? And when the bowels get slow, when they get sluggish, when they get blocked up,
Yep.
what happens is things back up. It's like you're a giant plumbing system, a closed system. If your bowels eliminate well, and you should be pooping 2 times a day, 3 times a day, before 10 a.m. or within 3 hours of waking up if you're a shift worker. And if you're not doing that, you're slow, sluggish, or even constipated, meaning you're just not going at all. Or the fourth question would be if you're not satisfied with how your bowels are moving. Like if you feel like you wish you could go more, or you have to use half a roll of toilet paper to get it done. And that's an indicator of dirty bowel syndrome. Now, I'm pretty sure I just made that word up, dirty bowel syndrome. But dirty bowel syndrome, if the average person has 10 to 15 meals caked up inside their gut, which they do,
Yeah.
that's three
There's
to 5 days worth of crap in
was
their
it like isn't it like 5 to 8 pounds of like just
more.
yeah.
John Wayne said it was said to have over 30 pounds of fecal matter
Wow.
caked up in his
30.
bowel with
That's
colon
it.
cancer.
I've never
And
heard of that. That's a significant.
Patrick Swayze, the famous, beautiful dancing guy, with pancreatic cancer, was said to have over 20 pounds. And that dude
Okay.
he was lean. He was, the sexy dancer of the day,
Yes.
and yet still pancreatic cancer got him.
Yeah, I mean, we can sit here all day and talk about obviously the overgrowth of issues, or I guess the overgrowth of bacteria, candida. I mean, shoot, I've been doing that cleanse, the parasite one.
Oh yeah, for
Yeah,
sure.
dude,
Can't wait for you to tell me how that's going.
dude, I'd say that I've been having the craziest bowel movements like of my life. I mean,
How
I've
old?
done a parasite cleanse before, and so this one now is just, I mean, it was like not to sound disturbing or anything, but like, dude, this thing was like probably like I'm not even gonna exaggerate. It's probably like a foot or 2 foot long, like one. And so
So look, so
I
check it
just
out. So I
reference,
always tell people this is not to offend anybody talking about poop, guys.
yeah,
This
exactly.
is how you analyze true health and vitality. You should have fawn colored fluffy floaters about a foot long, number one. They
Yeah,
should be easy to come out, more on the soft side. Uh, I would even say soft to loose if they had to be on one side or the other. Never hard, never dry, and never feeling like you wish you could go more. Or heaven
yeah,
forbid you skip a day. So the fact that you're getting, bigger, more badder bowel movements means you're dumping waste too. And
oh
so
yeah,
this is the thing is you wait 10, 15 years from now, and now you've got an issue. You're handling
exactly.
at your age right now, and now all of a sudden you're plucking weeds out of a garden very easily. Nothing's going to turn into a disease of
Yeah.
diagnostic
Well,
level.
the biggest thing is that, I read a lot of I read a lot of blood panels, and everyone's kidneys are just EGFRs. They're just through the roof. But then like usually when I do a lot of like the stool testing and things like that, they start to clear up, obviously, because you're opening up, the bile, you're opening up liver detoxification. So obviously you're getting things moving. I think also electrolyte balance is also really crucial to actually restoring that too. But yeah, it's
Well, I would say that like there's a book that we were up in Arkansas taking my daughter to college,
mm,
and we went to the hot springs, and the massage person was telling my mom, and you understand my mom's 77, so my mom is a classic example of alternative medicine working at its finest. So she's been my guinea pig for 20 plus years, right? She's done detoxes with me, parasite cleanses with me. She's done all kinds of things. So when she was in her 50s, she was on 6 medications and a hormone.
Hmm.
and bloated, unhealthy, not her best. She's 77, almost 78, and she is drug free.
Hmm.
And so she is healthier today, more active today, still flies around the country to see my brother and drives to the north side of town to see her sister. Her and I do, she comes to Bible studies every week. She is a very active 77-year-old, right? And, and I say all that because we all are hoping for longevity. And if we don't address the essentials of life, and this person at the massage place we were at in Hot Springs said, "There's a great book you need, Miss Kathy." And my mom was, "Really? What is it?" And the book's name is "You're Not Sick, You're Thirsty." You know, like how powerful water is. And so going back to your question, like how do we go upstream? Well, we first got to look at the bowel. The
Hmm.
bowel slow down, and let's say you're supposed to get rid of 2 pounds of poop a day and you only get rid of 1.5. Well, that's a half a pound of do that you're holding on to, trash,
Yeah.
toxins, waste, debris that you're not getting rid of. Well, that puts a half a pound of extra work and pressure backlogged onto the liver. And so most allergies and most lung problems and most skin problems are essentially liver congestion
Mm.
due to a dirty bowel issue that
So would
has
you
now
say that that'd
become
be okay? So would you say that'd be the influential response that comes from the immune system when you are dealing with a backed up liver, or would that be different as opposed to if you're looking at it through like a lens of like an increased permeability?
so at this moment, I'm just thinking permeability. Like if you have the square footage of a tennis court in your GI tract for absorption.
Okay.
Remember, let's talk about your GI tract real quick. Your
Yeah.
GI tract is very, very busy, meaning it's to digest food, it absorbs food, it manufactures nutrients like B vitamins, neurotransmitters,
Water
and
soluble, fat soluble.
and it
And then you have
excretes
the gallbladder
waste.
too. That's a different topic, but
Well, that's a part of it. That now you have a damaged digestive system that needs to be supported.
yeah, and which can be for
And
sure.
if you have all of those areas of the gut happening at the same time, that's a lot of function that needs to be managed well. And so if you're putting in food, which I like to call the crap, excessive carbohydrates, too many refined sugars, artificial ingredients, and processed boxed foods, you are clogging up your digestive tract, decreasing permeability, slowing down the manufacturing of B vitamins and neurotransmitters. And the slower that system
Yeah.
gets, the harder the liver has to work. And so the body says, shoot, I got to off gas this. And so it pushes it into the lymphatic system. And if it gets stuck in the lymphatic system, and now you're catching colds every time the weather changes or somebody coughs on you. Now you're susceptible to more in the environment, and the weather actually does affect you when it shouldn't,
Yeah.
right? You've been pushed too close to symptom land, and anything above the line is going to be symptomatic, diagnostic, or catching stuff that you don't want to catch. And so,
Okay.
yes, it is immune, but we're just at a simple going, we got to clean that bowel, decongest that liver, open up those lymphatics, wash those babies out, and then the system doesn't allow for trash, waste, and debris to clog up the exit strategies like your sinuses. So if you got sinus stuff, high lymph is being challenged
Yeah.
because the
Well, I
this
guess, well, at the end of the day, it all goes back to what Hippocrates has mentioned, all disease begins in the gut. It truly.
bingo, bingo.
Just
You
because,
know?
well, I mean, yeah, well, I mean, so here's the thing, though. I love that you're talking about this because I think it's crucial. But when we actually talk about that, like gut-centric healing, which is what we're speaking on, gut-centric, most people think that you need to start killing off rather than open up detox. I mean, you learned it obviously through the foundational medicine,
Yeah.
through, you saw that stuff through Cellcore anyway. I mean, I honestly practiced that before I even learned about that, to be honest. So what that then means is that what we're trying to do here is so we have people that try to go in and try to like heal the gut, fix the gut before even detoxing. And would you say what would you say about that?
Yeah. So, I look at it like this. In nutrition, we expect no negative responses by feeding people, right? in nutrition, you can never be wrong. You can only be more right. So
Hmm.
would I go in on day one? Had a patient just a little while ago. We had they speech delayed child, right? So they have essentially had some version of an autism situation.
Hmm.
And so the kid can't speak. The kid is very, very sensitive to the surroundings, people, new people especially. And inside of 6 weeks, we saw a complete shift. The kid can talk, the kid is reading, the kid is singing and telling his parents stories, and it is fast. They're like beside the parents, the grandparents, everybody's fired up and excited. It's like a miracle. And we're like, praise the Lord, praise Jesus. We're excited. This is awesome. And it is awesome. And then she said today in her third visit, she goes, well, what about parasite cleansing? We're really excited about doing some parasite work. I said, yeah, yeah, yeah. We will, but we have to address the priorities first in this case. So in this case, it was all metal burden, chemical burden on the nervous system. So because of the gut brain axis, we didn't want to put too much stress on the body at the same time because you can detox too much too fast.
Yeah,
And that can
absolutely.
cause those Herxheiming reactions. And you can have negative responses and it scares people.
Oh, I
Right.
know. I had mine for sure. I mean, obviously I was okay with it because I knew what was going on. Like, I was taking them all. I mean, it was excessive. Obviously, you saw the stack. And so, dude, I was just sitting here and I was like all out of it. Like my mind was so lethargic, and I was just like, geez, like it was. But going to the sauna though was probably the best part of my day at that time. Was just like obviously just taking my it would have been like my second or third serving of the day, and then get into the sauna and just obviously 200 degrees.
So let's look at answer your question. Let's say I had a blood test. So in this case, when I look at blood panels, if I see high eosinophils, I would know in a white blood cell CBC with differential that there's high metal in the body, trash in the blood, dirty bowels. So that's what I would
It's
be
a
looking at
combo collection. Gut,
first.
gut. You're saying like if you're looking at the white blood cell count, you see, you said neutrophils and what
Well, in this case, it would be so when
the
you break down a white blood cell differential,
yep.
we're looking at eosinophils, we're looking at white neutrophils, lymphocytes, we're looking at basophils, and when we see the neutrophils, hey, quiet, you want to say hi to my dog? Likes to be on the air.
Cute dog.
Uh, when you see a elevated neutrophil count, low white blood lymphocyte count, that's a bacterial pattern. So
Mm.
I okay, I'm dealing with an infection. If it's high lymphocytes, low neutrophils, I would know I'm dealing with a viral pattern. If I see high monocytes, I know I'm dealing with toxins in the blood.
Yeah.
If I
I
see high eosinophils, I know that I've got food allergies, parasites, inflammation in the digestive tract. I can target my approach just using blood work.
Well, dude, I love that. I love that. I mean, hone in on that. I mean, just being able to identify without doing a full-blown, I guess, a stool analysis, just through blood work alone, kind of find out where the body's at with its toxic load.
It's just an easier barrier to entry because here's the
Yeah.
problem. Listen, I think anybody over 38 should do a stool test every 2 years. Anybody over 42 should do a stool test every year unless they have symptoms. They should do it every year. Because here's the reality. Seeing who lives in the gut is powerful. The problem with the stool test is they are a little cost prohibited to many people. People don't like pooping in a hot dog tray, but I try to help them understand that there's no value to seeing what's in there. Go like you can't put a price tag on seeing who's living in your GI tract. Like I wouldn't move to a new part of town without finding out, am I moving to the hood or am I
Yeah.
moving to a nice area, right? So if
Mhm.
I look in your GI tract with a stool test, which is nice to have, and I see parasites, opportunistic infections, H. pylori, dysbiotic.
Side note, which one do you like typically like using, or what do you use? Genova Diagnostics? Or are you using, well, I
I
guess
use
company.
diagnostic solutions.
Okay, diagnostic solutions. So you're
Yeah,
typically just using a GI map.
yep,
So I'd
yep.
love to know your ideology behind it. Like, okay, so just because parasites aren't in the stool, you know that.
Good question. Yeah, yeah. So that's great. So look, guys, parasites can live in your sinuses and never show up in a stool test because a
Up in
stool
the
test
brain.
does not test
I know my
the
clients are gonna
brain.
be going crazy after this one.
Yeah, yeah. You can have parasites anywhere in the body. The great Bob Marshall always said, if you don't get the pH right in the body, if you don't get the body out of that lactose dehydrogenase level, that high lactic acid, high inflammation, if you don't get that handled, parasites can run rampant. They have no boss, no boundaries. They just run like a bunch of hood rats through the territory and tear up things and vandalize stuff. That's sinus infections, that's migraines, that's brain disorders like multiple sclerosis, or that is like dementia, right? So we start seeing like parasites are those things. And I have patients that see parasites. If you have floaters in your eyes that are squiggly, those are parasites that you're seeing floating around in your vision. That means parasites are in your eyeballs.
So,
And it
so tell me this,
chart
Doc. Like,
parasite on a GI test.
so if I was looking at this Dr. Chappa and I was like, if I if you walked into a primary care or even endocrinologist, OBGYN, you walked in, what do you why do you think they would look at you like you're a crazy person if you talk anything relative to what we're saying right now?
Well, they kicked us out. They fired us. They kicked us out because we asked questions about simple birth control. See, these guys are
What are we
trained
talking about? So
on.
like you got kicked out?
Yeah, me and my wife, we because before we had children, we were investigating who we were gonna, call our medical provider when we go to have children. We needed to
And you
find.
just said, screw, I'm doing it at home.
Well, yeah, because they kicked us out, and so we got us a midwife, and we learned some things, and we discovered that, I mean, we have a lot more
By the way, I'm
control.
gonna have to hit you up in a few years for that one, but
Yeah, for sure.
you go.
But the reality is they have less than 6 hours of nutrition training.
Yeah.
They're taught, okay, that food has no bearing on health.
Yeah, I just
Cancer patients are fed ice cream. Are
oh
you
my
kidding
God.
me? You can't feed a cancer patient ice cream. What's the number one fuel for cancer cells?
I mean sugar.
Sugar.
Yep.
Sugar. Why are we
Yeah, I knew
allowed?
that one. I don't know. No, I'm kidding.
Yeah, I mean, it's like rocket science, right?
Dude, no. Oh man. Did you know? Did you want to something crazy? I just looked at this thing and I was looking into it because you can't believe everything you see online. But apparently back in like the 60s when the CDC was founded, Coca-Cola bought out pretty much. So anyway, the essence of it all is that essentially the CDC moved into the Coca-Cola building, and then Coca-Cola was telling the CDC to steal the results on what sugar was doing. So then they blamed salt. So then they started to believe that all these heart conditions and issues came from elevated salt. When in reality, it came from people ingesting 40 grams of sugar a can of Coca-Cola. And obviously, if you know, I mean, you can tell. I mean, I wasn't there for it, but what used to be in Coca-Cola? Like,
Like, well, real sugar, right? And
yes, no
cocaine.
sugar.
I mean, that's why it's called Coca-Cola,
Yes,
Coke.
yes,
And
exactly.
so now
So
it's
it's
an
an addictive chemical. It's an addictive chemical. They knew, so then they can put you on blood sugar medication, cholesterol medication. It's like you got the smartest people in the world, MIT. I like these people that are very educated, that for whatever reason, do I don't know what, decided that money was more important than humanity.
than
Humanity.
humanity. And so look, it's a he who controls the food controls the world.
Exactly. And
And
what are we
if
doing
you
right
can
now?
make a society docile, if you can make a society sick, you got them trapped forever. And it's a money making, generating money machine. It's like having a money tree in your backyard. And so going off that road, like the R in crap is refined sugar.
Yep.
And I was sitting with one of my mentors one year about 18 years ago, and her and I were talking one morning, and she said it's simple, Chop. She was already in practice 10 years prior to me. Okay, so she's out ahead of me, and this
Yep.
was back then. And
Oh,
she
no,
said,
awesome. Yeah.
if people could get two things right, take care of your adrenal stress mechanisms, your
Mhm.
endocrine system,
Yes.
and just stop the sugar, alcohol, whether it's excessive carbohydrates, refined sugars, if you take that out for 30 days, 60 days, 90 days, 100 days, you'll reset pathways of inflammatory overload, toxic overload, and you will turn your body back into a healing vessel, not one that's just surviving and putting out fires.
Yeah.
And so now take that, watch this. For those that are still afraid of salt, okay? Remember, in the Roman days, they would guard a salt mine more than they would guard a ruby, gem, gold, silver mine. Why? Because salt was more precious to life than any other precious metal available. That's where the word salary comes from. I hope that man is worth his. Does anybody know the answer? Salt. I hope that man is worth his salt. That is a Roman terminology. And they used to torture people by taking them off of salt. They would go crazy over 100 days. And when you, if you and I were together, okay, and we were in a group of people, and somebody passes out, and you and I don't know what to do, we're like, I don't know, call the cops or call the police, right? And let's just say, and so this person's unconscious. The paddy wagon shows up. They throw him on the gurney. They put him in the back of the meat truck, and guess what they're going to inject into the patient without knowing anything about their medical history?
Just saline. Was that
Oh yeah, what is saline?
sodium? I think, right?
It's
Salt.
salt.
Yeah.
It's salt
Boom.
water.
Yeah.
So they've
That
demonized
just ripped out my.
salt.
I just guessed that.
They're demonized salt, but yet in an emergency situation, they put you on salt. Isn't that interesting?
Well, no, I think every single time you're getting administered into the ER, you get always automatic. It's saline. It's saline,
Yeah, but
automatic.
if that's the case, then why would they tell us that salt is evil?
That's a
You know
good
what I mean?
reframe.
And that's my
Great
point.
frame. That's
Is
crazy.
salt is not evil. It's never been evil. It's an essential nutrient. It's a nutrient that actually never changes. So like when in the Bible when it talks about Sodom and Gomorrah, Lot's wife looked back on Gomorrah and she turned into a pillar of, do you know? Salt.
Mm.
Interesting. So salt, when I put it in my drink, goes from a crystal into a liquid. When I put it into my body uses that salt aspect crystal in the liquid form and it electrifies your tissues. It turns your tissues into engines and they begin to function at high rate. And I can't tell you how many people come into my office and their salt levels are completely
No, all the time.
all the low. And you got to get the salt levels up. And people are again, even with the high blood pressure people. Now, you don't want to get just any old white salt. You want to make sure that it's a sea salt. You want to make sure that it's 2,500 meters below the sea. You want to make sure that you trust where it's coming from and it's properly managed so that it has all those extra trace elements and trace minerals. And then interestingly, it's in our body, right? And then let's say that you and I sweat really hardcore in the sauna, and then they take that sweat and then they dry it appropriately. What's left? Salt.
Yeah.
It pours out of us. So the fluid then comes back out as salt crystals.
Hmm.
So salt never changes its molecular structure per se, but it changes form, just like water, gas, and ice. It's still H2O.
Hmm.
You know? And so we have missed it on the simple things. Hydrate well, get rid of the crap, and all of a sudden you will start seeing your body turn the corner. Then you can come in and detox the bowel, detox the liver, open up those channels. And I say detox, I mean just flush them. You don't even
I
have
think
to
I think
do
today,
a hard bug killing program.
well, I think in today's time, many people have distirred from these basic fundamentals and getting well. I think with new things coming out every single day and whatever, people have just totally forgot how to actually take care of themselves, the correct way. So, I think a lot of it's just been the steer dogma behind like everything is such black and white for everyone. When in reality, you and I know that it's multifaceted in terms of like, well, just referencing back, like 20 minutes ago, when we're talking about these issues, like chronic migraines, chronic fatigue, low energy, whatever. Yes, we can look at the gut. We can look at, okay, what's going on? Is it backed up, increased permeability, parasites, all these different things. But what else is influencing that? And so, you can look at your hormones, you can look at these things, but like it's just like I just kind of want to harp on the topic of like, hey, it's not just one thing when someone's dealing with something, it's multifaceted. And so like all the time inside in my coaching and everything, I like to always reiterate like, hey, your issue, you keep talking about, you're saying, okay, we have slowed down gut motility. Okay, what causes slowed down gut motility? Meaning there's your bowels are sluggish. They're not getting through the digestive distress or tract. Okay, well, your cortisol is jacked up. You can even have poor thyroid function. You're dealing with a nutrient deficiency and you're not sleeping enough, you're not getting enough electrolytes, sodium, salt, you're eating shit, you're feeding more into candida with the sugar you're eating, and so when it comes to true restorative healing, it's not just a synthetic medication from petroleum. It's a real process that's not easy, that takes time, takes effort, but creates real lasting healing results um, over time. So, with that kind of being said, like, how do you like to relay that information to your client and understand it? Because, I totally know inside your 20 years, you've had a client you've worked with for 2 months and they're like, damn it, Chop, like, I ain't saying anything. I don't feel anything, and you're trying to relay to them, like, hey, it's not that anything's wrong with you. It's not that what we're doing is wrong. Is that true healing takes time. I mean, I learned from another person that like for every like year of like dysfunction you specifically are dealing with, it's like X amount of like months or time.
5 years of sickness, it's 1 year of recovery.
Okay.
And
Yep.
so if you've got diagnostics for 5 years, meaning you've got some medical diagnosis that somebody's given you for 5 years, which you know and I know, if a person's got a diagnosis, they were sick before the diagnosis showed up.
Oh my goodness.
And so
But
that and so
how many people go undiagnosed that I see pick up, but obviously, I'm not going to say that, because I'm not a practitioner or I'm not a
well, what's
medicine.
fascinating is that 67%, no, I'm sorry, 88% of people think they're physically healthy, but they're taking Tylenol, Aleve, some sort of, non-steroidal anti-inflammatory
Dude,
drug
yeah, that's a freaking
every
good
week
point.
or every day.
Every day, every day.
And then there is also 82% of people think they're psychologically healthy, but they've been told by a medical doctor that they have a brain depression, anxious issue, and that
Dude, it's okay.
they're often on a psychiatric med of some kind.
They've debunked serotonin deficiency.
That's right. And so the
They
reality
debunked
is,
that.
and interesting, watch this. Who makes serotonin? The gut. You have
Yeah,
3
90%,
million,
90%, right? 90?
3 million more neurotransmitters in your digestive tract than you do in your brain. And so if you have a dirty brain, it's
Like,
because you have dirty bowels.
mm,
And so what's causing it? Well, number one, the the crap, excessive amounts of carbs, refined sugars, artificial ingredients, and processed food.
all
If
right.
we can get that out of the diet, if we can get alcohol out of the diet, and people go, you can't talk to me about my alcohol. I'm like, look, then you don't want to be healthy. I mean, because if you've got symptom patterns you weren't genetically born with, you've got to make a decision. What's worth having? Energy, vitality, longevity, or, a little weekend fun at the cost of your health? Now, people go, well, I'm going to drink anyway. Okay, great. Here's my rule. You ready for my rule?
Mhm.
Because this is practical, right? You got people out there that want practical, like how we deal with real people. Because people go, look, you and Diego, y'all are crazy doing parasite cleanses and doing these detoxes. And we're like, no, 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 come along with us because it's really fun to feel good. It's really fun to have energy. It's really fun to have, story after story of
Yep.
how essentially we've overcome issues without even lifting a finger because we weren't diagnosed with a major health crisis. We didn't let the ball drop, so to speak.
Mhm.
And so
Sure.
the rule is no more than twice a week and never back to back days, even on a
Twice a
vacation.
week is still too much, dude.
It's terrible. But here's the
That's
reality, bro, is people are going to do it regardless. And so you have to you got to give them boundaries. So no more than twice a week, never back to back days. That gives them some gray area to play in. And while I'm playing inside of my boundaries, I'm feeding their endocrine axis. I'm detoxing their liver. I'm strengthening their immune
Oh, I,
system.
I I would just get I give him a protocol like, what is it? I think it was like 600 milligrams NAC, like 400 milligrams magnesium glycinate. I think I do a B methyl B in there, just a B1, B6, B12. Don't really need the B12, but B6 for sure. Um,
You mean if they're drinking?
yeah, yeah.
Yeah,
Like
because
I
you'll
say, well, it depends. I have people take stuff before they drink. I mean, I know it's kind of tedious, but like for me, for example, I never drink, and because I mean, I have those addictions in me, and so I know that that would not be, and it's also self-awareness. If you already know you're gonna have an addiction, do not do it. Why
yeah.
would you do it? So already,
Well,
anyway.
look, it destroys your health, that's for sure. But
I
you
mean,
got
there's no positive
yeah,
to
no.
alcohol, no matter if it's wine, no matter if it's beer, no matter if it's clear. Yes, there's better suggestions,
Well,
but
I always tell people this. It's simple. Like,
and
so
I'm passionate just because I've worked with so many like alcoholics, like ex.
I'm so as a Christian believer, right? The Bible is very clear, don't play with spirits. What's another name for alcohol?
I don't know, but I know that.
Spirits.
Yeah,
Spirits. That's
yeah,
what it says on the sign, you know?
yeah,
So don't
exactly.
jack with it. And but Carol's got a question here. It says,
Yep.
Doc, what's your take on fasting for healing? Oh, shoot.
Truth.
I have seen patients with blown disc in their back needing surgery do a 30-day water fast, no surgery. I've taken people with cancer and put them into a fasting state where we can get their body to eat up all that old trash and dump those zombie cells. It went through a process called autophagy. And all of a sudden, boom, you will see healing transpire. So I'm a big intermittent fasting guy. And so I'll have patients that have symptom patterns that they weren't genetically born with stop eating at, say, 6 or 7 p.m., right around when the sun goes down,
Yeah.
and not eat again until noon the next day when the sun is at its peak.
Hmm.
And that gives them about a 16, 18-hour fast, depending on their number. And that time frame gives their blood sugar time to reset itself. It gives their body digestively a time to do digestive assimilation, liver detoxification, maximize the neurotransmitter B vitamin assimilation, and prepare the body for detox that next day night. And so intermittent fasting or it for just a regularity is great, or extended fasting if you have a true autoimmune issue
Would you
or
say?
a cancerous issue is
I think I heard
great.
something. Yeah, well, I think I heard something that like some fasting could be as effective as stem cell treatment.
Right, because you're allowing your body, one, the time to get rid of the burden.
Mhm.
You're allowing your body time to balance out blood sugar through the natural process of gluconeogenesis, which
Yep.
is natural, the fight that we want to support. Because remember, you've got five hormones that raise blood sugar, you got one that lowers it. But yet we live in a diabetic culture. So, I guess God screwed up by giving us an imbalance in our hormones. No, no, no. We screwed up. We're putting in too much things that are stimulating our blood sugar through the roof. So
Mm.
what happens is
So let's go back there because those are the things that you can manipulate. So are you saying glucagon is the one that pulls it down, right?
well, yeah, when glucose is gone,
It's
glucagon.
yeah, glucagon.
No, no, no. Insulin pulls it down. Glucagon,
Yeah,
when
glucagon goes
glucose
okay.
is gone,
Okay.
glucagon raises it up.
Okay. Okay, okay.
Insulin lowers your blood
So
sugar.
so when glucagon okay then so when glucagon is raised, that helps our body get into that more the autophagy or not the autophagy but resensitizing our I guess bait what are they
Well, it's just
beta
how,
cells?
look, so your body operates on sugar, right? I
Yes,
mean,
primarily.
but
Yes.
here's the deal. Do you want to just put it directly into the vein at excessive amounts?
Mhm.
No. You want your body to divvy it out at its discretion, because your body has been designed and knows how much of this and how much of that and when to produce these different sugar molecules. We live in a culture and where we're putting in so much sugar so often that we aren't even using those glucagon or even cortisol effectively, which is what's causing our body to be wide awake in the middle of the night when we should be sleeping.
Yeah.
We're not getting into growth
So
hormone stimulation for
it's like
restoration
we
and
talked
healing.
about. It's multifaceted. I mean, you can get up because you have the liver detoxification, but here's I'm going to try to explain this into a healthy or a reasonable manner. So many people deal with obviously weight issues. Probably every single person that walks through your clinic doors. I mean, some. I'd say maybe yours. You deal with. I
Of
mean, you
course, everybody
deal
who
with a
does
lot.
everybody wants to look.
But what I'm saying here is that what's happening is that your body is so stressed out and inflamed that your body keeps releasing insulin. This is what we're talking about. Your body's always releasing insulin from your pancreas. So now what's going to happen is your body becomes less responsive to the insulin signaling. This is called insulin resistance. This is pre-diabetes, diabetes. And so what Dr. Chappa is trying to say is that we never even have a spot because we're always eating, we're never taking a break, we're never doing the intermittent fasting, we're never helping. I mean, I honestly always have clients do intermittent fasting at a specific point. There's a lot to it. But anyway, so I want you to talk about too the connection between the gut and the liver. Sorry, insulin in the gut and insulin and liver. Like what is that interconnected relationship like?
So
Because
adrenaline, insulin, and cortisol are very catabolic, meaning they're
Yep.
very destructive type
So
hormones. They break things down, open things up, and when they're left unchecked for too long, you start to see blood sugar spikes and blood sugar dips like on a roller coaster. And it's very stressful to our physiology. Well, if the gut is constant and sugar, because of the type of sugar people are eating, excessive carbs, too much refined sugars, too many artificial ingredients, too many processed foods, it's like razor blades in your gut lining, and your gut lining never gets a chance to heal. It never gets a chance to repair itself. And so excessive cortisol stimulation because of bad diet, because of stress levels that are through the roof, your body is constantly fighting healing. So when you're stressed out, your immune system in your gut crashes. When you eat too much sugar, your immune system crashes. Whenever your insulin levels are constantly being stressed out, the cell becomes adapted to it, resistant to it, and it doesn't bring sugar into the cell. It leaves it now in the blood, and now it creates arterial damage. So now you're jacking with the lifeblood of the vessel, and the lifeblood is acidic.
then you
So
just fix it with
now,
metformin, right?
sir?
I said now you just fix it with metformin, right? No.
Oh yeah, of course. Absolutely. No, and that's true, but that's why we want to look to diet first. And so I always look to diet first. How can I clean up the diet? And then I look at what I call the inflammatory foods, the four deadly foods, and then the crap foods, and then I start detoxing. Because when you start cleaning up all like you said, the facets of health,
Yep.
now I'm not just leaning into one thing, and that's just it. There is no one thing. It's all interconnected. Your hormones are connected to your gut, your liver's connected to brain function, your lymphatics are connected to your blood, your lungs, your lymphatics, your immunity, your kidneys are your energy jetpacks. I mean, everything is like a watch. Which part of the watch tells time? And
Mm-hmm.
the answer is all of it. I
Yep.
can't take anything out of my watch in my watch work. And so every part of it has to function. But yet we think we can, we can do a gastric sleeve on somebody's stomach and they'll be healthy. Not going to happen. You think you can remove a gallbladder. Oh, you don't need that. Baloney Mahoney. You want cardiovascular disease? Lose a gallbladder. You know what I mean? You think you can function without portions of your intestine. Sorry, doesn't work that way. Every
That
part
that's
of you matters. Every part of you matters. And
why do
then
you think God made it like that?
that's
Why
exactly.
do you think he made that? Why do you think that the Lord has made you? Yeah, I can't reference the exact.
Fearfully and wonderfully made,
There you go. And
knit together in your mother's womb.
yeah, exactly. So then why do you think, where did this ideology come from? To just remove a piece of you? You know,
Yeah,
it's
it's
just
one of
like,
the most barbaric things that we do as a culture. It's one of the like jacking with a human stomach is one of the worst things that we've ever thought was a good idea. And so when you put people on antacids, when you do a bypass, when you do a sleeve, you are you are ruining a human's health. They will have a slow demise.
Okay, so can we get, okay, so it's a little bit of the doctors for sure, but it's the system that they're induced in. It is the system that is teaching them and indoctrinating them to believe these ideologies behind this is how you heal someone. This
Well,
this is this is how
there's something out there called there's people that'll listen to this podcast and think that they'll mock us for what we're saying. There's thinking that that they'll laugh at what we're saying.
yeah,
Then there's the people out there that'll be perplexed, and then there's the people out that are listening to our podcast that'll be what I call the believers. And I
yep,
think we're talking to the believers today, and we're hoping to wake up some of the people that are the sleepers. But unfortunately, life is filled full of mockers and laughers and the perplexed. And I kind of gave up on trying to figure all that stuff out. I just know how to help people get well. One cell at a time, one bite at a time, and helping people find the root cause of where their issues are. And what I've discovered is like there's so much propaganda on the food industry essentially driving us into a hole, the cigarette industry driving us into a food coma. I mean, it's amazing. Sorry about the dogs. But at the end of the
okay,
day, I have found that if we just help people understand that it's their life, their health, their choice,
yep.
we can help them go onward, upward, goodward, Godward, and see
You have
a
the empowerment.
life, a new life,
Yeah. I mean,
free of
that's powerful.
symptoms.
That's so powerful because you, when we look at like the whole thing of like westernized medicine. And by the way, when they always come, okay, so westernized medicine, when we look at it in wholes, I mean, that's been around only for about 100 years now. The 100 years ago is 1925. Say about 10, 15 years prior to that. That's when it started. That's when conventional Western medicine essentially started with making pharmaceutical factories and companies and started going through that. But then we look at all this time beforehand, all hundreds of years, thousands of years before that. And how come they call that pseudoscience? How could you call that pseudoscience when that was before the man-made things? Lion's mane for the brain, just apple cider vinegar for stomach acid, oregano oil for dysbiosis. Like why would you? They say that's pseudoscience when then they give you rounds and pushing antibiotics for every single infection. Why would they not get? Why would they not think that maybe getting some sun improves depression? Where did that come from? Where did serotonin even come out of the equation? Like where did this? So when we actually stop and we actually look at the history and we stop, because what happens is we grow up and we're thinking, oh, I'm sick, I'm gonna go see a doctor. Which, I think, as I always say to every single person, like, okay, if you have a gunshot wound, you won't come to someone like Dr. Chappa and I. You would not. You go to Western conventional medicine, and that's what they're great at, is for acute care in situations. But when we're talking about chronic issue, which many of them, I mean, 70% of America is not well. And so that's when you need to focus on these real healing modalities because they fix you. And
So
so
here's what I have one for you.
yeah, yeah.
So I learned this from one of my mentors. It's called
This is
the
one of my mentors, Dr. Josh Axe. I mean, one of the greatest humans. He actually just came with a new book. This is a great
okay.
book.
Yeah, yeah. And I think, look, I
This is a
think
great one.
we need to remember some of these ancient truths. Okay.
Well,
So the root history of healing, 2000 BC, the prescription would have been here, eat this root.
yep.
1000 BC, that root is heathen. Here, say this prayer. But as time passed and we began to understand some things, say 1850, that prayer is superstition. Drink this potion. 1940 AD, this potion snake oil. Here, swallow this pill. 1985 AD, that pill is ineffective. Take this antibiotic. A lot of them. 2000 AD, more antibiotics, they don't work. So here, give the cholesterol pill, the blood pressure pill, the neurogenic pill, and joint pill. 2017, the pills don't work anymore. Here, eat this root. We're back to it. It's just a cycling history. And we can go back in time and see where root cause medicine, getting back to the ancient foods, the real foods that had a mother or a father that grew out of the ground is valuable. But yet we have Americans and people all across the globe eating fake pseudo food. And if you eat make believe food, Diego, what are you going to get? You're going to get make believe health.
Yeah, say that twice. I mean, it's honestly astonishing, but I think at the end of the day, it's almost like faith where you just can't comprehend it. You just there's just no humanized rationale behind what they're doing. Like you can't even like rationalize it. So that's why the work that like your colleagues that you say, the colleagues I have, because like before it used to be like like a dog style type of business where like it'd be like, oh, we're competitors and things like that, but it's not even like that anymore. With how many sick people, with how many people that are in distress and distraught, how many people and where we're going,
Diego, let me just tell
it's
you, as iron sharpens iron, so shall one man sharpen another. We have to become wellness warriors at every level, at in the homes, in business,
yeah,
at every level, because that's how you fix anger management. That's how you get people thinking. The hardest thing to do in life is to think. Sick people don't think, they survive. And they make bad decisions. They rationalize bad behavior. We have to manage the control cycles. You and I have the ability to help lead the charge, and then we get to share with different wonderful people that come on podcasts like yours and share this message and get enrolled themselves at self-selection to choose life one bite at a time, one good nutrient at a time, one new concept idea at a time, in order to maximize how they're going to impact not only their families but their kids, their grandkids, and
generational
the next
health.
generation. This now becomes a wellness, like, generational gift that you and I are giving. And you're right. We can't be in competition. We have to be rising tides raises all ships, and we need more great, courageous people. But when people are subdued by poisons, make believe food, when people are chemically altered with excessive antibiotics or drugs, when people are not feeling well in their bodies because it's sick, somebody has to reach out and say, I got an answer for you. And there is no medical papers on that.
Yeah.
And that's where science really has failed, is they bought into it's all got to be proven and we have to know every little understanding piece about everything, and it's just impossible. You can't do it. And you've got to trust that food is medicine and
It
medicine is
that's been
food.
proven.
Forever.
I want to reference one more thing because this is at the end of the day, I think this is kind of where it all ends because as hypocrites had said, before you heal someone, ask him, meaning everyone, them, if he's willing to give up the things that made them sick.
Painful, painful truth, my brother. Painful, painful truth.
So
And
I wanted to leave on that because people can leave this video today. They can be this, but what did Dr. Champa and I say in terms of like was any of this information profound to you? Most likely the physiological things that we spoke about for sure, but what did Dr. Champa say at the end of the day? Stop eating sugar. Stop with the fake foods. Get exercise in. That
can't
see
talk about that. That's a whole nother podcast. I'd love to
see
do that.
see
But
the
yeah,
thing
if the
is that
dude
like
don't move, the dude don't groove.
see, like, so, like, what we're saying at the end of the day, this isn't information that's just like coming out of Harvard and John Hopkins. This is this is information that's been rooted in truth for hundreds of years, thousands of years. So, if you're leaving this video today, like, just remember, we can't heal in the same environment that made us sick. Okay, so we want to make sure that we can't be doing, the definition of insanity. And so, yeah, I want to leave that there too, because I mean, that's important. And then obviously, whatever, a couple quotes I can, reference from him. I mean, all disease begins in the gut. Let food be thy medicine. Like, it's all huge. And yeah, I'm gonna post it on my Instagram. I mean, Instagram will probably it only posts like 15 minutes, and then I'll probably shadow ban it like the rest of my page on Instagram is. That's why I have to do freaking in-person stuff too. So, they, I mean, I got my first IG account shut down. People don't even know about that. I grew to like 19,000 followers in a year, but I had a whole Instagram account before this one. I didn't even tell anyone this. Shut down. They shut it down. So I really watch what I say now, except
And
when
again, we do. We have to be mindful. We're not trying to, ruffle feathers, but at the end of the day, we do have to be strong and courageous to share truth. The truth will set you free. And the things that we're talking about, these are nutritional truths that have withstood the test of time. And I
Mhm.
think that, I'm proud of you for doing it again. I mean, you could sit around and mull around over the fact that you lost 19,000 followers, or you can say, well, okay, I'm just going to build it again.
God's grace, God's
That's
grace, every day,
and
every day.
so,
It's
all
power.
right. I mean, man,
Jabba.
totally, totally digging it, brother.
We got to have another one though. We got to have another one. You know, I think the next one we'll have is it's an Instagram one. We'll do an Instagram one. I think we spoke about
Okay.
that last time. And we'll talk about some more topics. I think we should go more in depth, and then, like I said, we got to block out more time too, for sure.
Yeah, it's one of those things, brother, where we just gotta it's consistency in the process. So, I just want to say thanks for letting me be a part of your show. Definitely, I enjoy sharing the message of health and healing to many, and it's stuff like this where we get to. I mean, you're in another part of the country, and I'm in another part of the country, yet we're influencing and making a difference. So,
100%.
carry on, onward, upward, goodward to God, brother.
All right. All right, everyone else. Have a blessed rest of your evening. See you.